Dental hygienists only clean teeth, right? They're teeth cleaners.
Eek! That's actually a big misconception. Hygienists do a lot more than that. Let's talk. Hi, my name is Whitney and I'm a dental hygienist here to talk about all of the responsibilities of a dental hygienist, things hygienists do other than cleaning teeth. And really quick, if you want to learn even more about becoming a dental hygienist, I have a free RDH video checklist, which I'll link below. So first things first, what is a dental hygienist? A registered dental hygienist, otherwise known as an RDH, are dental professionals with a 2-year or a 4-year degree in dental hygiene. So similar to nurses, they complete a 2-year program in their field after completing necessary prerequisite classes like microbiology or anatomy and physiology. So if a hygienist has a 2-year degree, that doesn't mean they only did 2 years of college. They more likely than not also did around 2 years of prerequisites beforehand, and then after a dental hygienist graduates, they also have to take written and clinical national board exams before being licensed to practice in their state. Now, what does the RDH really do? What are the responsibilities of a hygienist? The majority of what an RDH does is related to direct patient care, but there's also a lot that goes on behind the scenes between patients or before the office opens up and after the office closes each day. Job responsibilities can vary from office to office depending on the management as well as which state you're located in. But a typical job description of a dental hygienist will consist of things like cleaning teeth. We know this is the one we know. But as a hygienist, you're not just cleaning teeth like an assembly line, one patient after the other. No. Every mouth is different and some patients require different types of cleanings than others. There's regular prophies, the 6-month cleanings, there's scaling and root planing, SRPs, the deep cleanings, there's perio maintenance cleanings, there's pediatric cleanings. So depending on the patient's age, gum health, and how much buildup is on their teeth will all determine which type of cleaning they need. For most cleanings, you'll be using some type of combination of manual hand instrumentation and ultrasonic instrumentation to remove plaque, tartar, and stain. In addition to the cleaning portion, you'll oftentimes also polish their teeth as well to remove any superficial stains. Other preventative services that happen during the dental cleanings include administering fluoride treatments. I have a video all about the different types of fluoride. It's called something like why you have to wait 30 minutes after cleanings to eat or drink. I'll link it below if you want to learn more. Placing dental sealants, the protective coverings on adult tooth molars. I also have a couple videos about sealants. Taking dental impressions. There's lots of different reasons why a patient might need impressions for night guards, whitening trays, what have you. There are alginate impressions and digital impressions and bite registrations, a bunch of different dental materials that the hygienist learns how to work with. And then after they take the impression, they may need to make the models in the lab as well. Some offices will have dental assistants do the lab part, or sometimes even send the impressions out to a dental lab. But regardless, hygienists need to know how to do it in case the office requires you to do it. Taking and interpreting dental X-rays. Quick video interruption. One more time, I'd like to remind you all about my free RDH video checklist. If you are someone who is interested in the dental hygiene career, I made this video checklist especially for you because I get a lot of questions in the comments and messages asking me how to become a dental hygienist, whether you were in high school, whether you were in college, or maybe you already have graduated dental hygiene school and you're looking for more information post-graduation. Whatever the case, if you're interested in learning everything there is about the RDH career, be sure to click the link below. Now back to the video. Back to number 5, dental X-rays. Most dental hygienists take their own X-rays when they have a dental patient. Sometimes an assistant will help if they're available. Again, it just depends on how the office flows. Dental hygiene school gives you plenty of practice on getting the angulations right so that you can see between and around the teeth rather than overlapping them. And after you take the X-rays, you'll also learn in school how to identify everything that's on them. And then in the real life workplace, the hygienist will go through them with the dentist and decide the treatment plan together if necessary, or the hygienist, they're oftentimes expected to bring it to the dentist's attention. Technically, in most states, hygienists cannot flat out diagnose. They can't flat out say to you, hey, you need a root canal. No. However, kind of like X-ray techs, they are still expected to understand X-rays, and with experience, they know what the patient needs. So they collaborate with the dentist who is able to give a definitive diagnosis. Number 6, assessing oral health needs. Your hygienist will usually pre-screen the patient's mouth for dental issues by measuring bone levels and gum attachment to see if there is any active periodontal disease or history of disease. This information is very important in determining which type of cleaning is needed. Additionally, hygienists will perform an oral cancer screening to identify any abnormal or precancerous areas inside of the patient's mouth, checking for lumps, bumps, and anything irregular. Number 7, educating patients. Dental hygienists spend a ton, and I mean a ton, of time educating patients. If you've ever been a patient before, I'm sure the first thing that comes to mind is your hygienist asking you, do you floss? There's way more to it than that. Some of the things hygienists will teach patients include oral cancer, nutritional counseling, oral symptoms of systemic health conditions, how to care for specific types of dental restorations or prosthetics, implants, dentures, etc., brushing and flossing, of course, and risk factors associated with certain medical backgrounds or lifestyles. For instance, if a patient has dry mouth from the medication they're taking, the hygienist will discuss the effects of dry mouth, xerostomia, which is tooth decay, and how to reduce the heightened risk of tooth decay. Number 8, administering local anesthesia. Most states have dental hygienists administering local anesthetic or numbing medication, but even the few states that still don't allow it, they still require RDH students to train in this area of patient care. So local anesthetic numbs specific teeth or parts of the mouth depending on where the injection is administered. Most of the time it's used for SRPs, the deeper cleanings, to make the patient comfortable during it. Sometimes the job description of the dental hygienist will even include numbing the dentist's patients for them if they're between patients. This helps improve patient workflow for all the practitioners in the office. And of course, administering local anesthetic also requires knowledge of the pharmaceutical drugs and knowing how to rule out any contraindications, such as determining which anesthetic is best for patients with different medical backgrounds. Number 9, recording medical and dental histories. I can't stress this one enough. One of the most important job descriptions of a dental hygienist is reviewing and evaluating a patient's medical and dental history. You might be like, what? Why is this important? Updating the patient's health history at every visit is important in order to avoid potential interactions, complications, or even medical emergencies. This includes going over any medications they are taking, whether they are prescription or over the counter, discussing any recent hospitalizations or surgeries they've had, and making sure they have the most up-to-date information related to any medical diagnoses. Many times blood pressure will also be taken, and referrals to medical doctors may be necessary, especially regarding things like sleep apnea, things that start in the mouth. Hygienists are also expected to chart existing dental work in the patient's records, so they paint a picture of the current mouth and update it as necessary. Number 10, documenting treatment. Record keeping is an extremely important clinical and legal responsibility of the dental hygienist, as it is for all healthcare professionals. Maintaining records and writing or typing out what services were rendered that day is vital to the quality of care for the patient, as well as maintaining the dental hygiene license. Number 11, collaborating with the dentist. Sometimes hygienists need to have short micro meetings with the dentist between patients to help strategize care plans for specific patient needs. Again, even though dental hygienists aren't legally diagnosing disease, they still play an important role in identifying and pre-screening abnormal or irregular dental issues. In other words, a hygienist may know for a fact that it is a cavity or an abscess, but they will have to have the dentist check off on it to make the formal diagnosis. So lots of dental hygienist-dentist communication is necessary. And lastly, number 12, odd jobs around the office. Aside from seeing patients, some dental hygienists will also be responsible for ordering supplies and maintaining inventory records in their office. This might include making sure gloves, masks, prophy paste, and all the other materials are stocked at all times. Additionally, they need to help with sterilizing instruments between patients, turning over the patient room, disinfecting, and getting it ready between each appointment. I have a video that shows my day in the life, and it really displays the in-between patient times, which I'll also link. And yeah, if there's any additional downtime between patients, like if a patient cancels, most hygienists will be helping out with calling recare patients to schedule their checkups, mailing out postcard reminders, answering the phones, or performing other administrative tasks if everything is done in the back on the clinical side. So that's that. If you're someone who's considering becoming an RDH, yes, you will be cleaning teeth, but your responsibilities will also consist of a host of other roles. So I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. If you want more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.